Yeah, diamond black fan anemia is an extraordinarily rare disease. It's about an incidence of 1 in 150 to 1 in 200,000 births. So there are 20 to 40 children a year in the United States and Canada who are affected. The disease is a very fundamental one to hematologists. When you have diamond black fan anemia, you don't make red blood cells, and that is the essence of the problem. Of note, these patients are also predisposed to unusual cancers presenting at an earlier age than you would see in the population at large. Our work has been to try and understand the biology of the disease, to try and assist patients, and to develop therapeutics.
These patients are born not being able to make their own blood. They don't make red cells at all. So they either have to be treated with transfusions for the rest of their lives, or they somehow respond to steroids, or they need steroids for the rest of their lives. And we're trying to find new ways to help them do this. They can have a bone marrow transplant or a stem cell transplant to help cure them, but it only cures the anemia part. The children are born with congenital anomalies, they have a predisposition to cancer, so our small group has now spread out to multiple areas and multiple facets of this illness.
So the Diamond Black Fan Anemia Registry was actually established about 25 years ago. And the goal was to try to understand the disease better because it's so rare. And by collecting information on all the patients, we're able to sort of understand what causes the disease and treatments, and trying to find genetics that are involved. And without the registry, we wouldn't be able to, because patients are scattered throughout the country and there's not that many of them. And having the patients sort of collectively joined with the registry, you kind of learn a lot more about the disease.
And we have run the registry now for 25 years. It is in the United States, Canada, and Mexico is the North American registry. And we now have offshoots, not our own, but ones that we've helped foster throughout the world in diamond black fan anemia.
Well, I think when you're in the business of caring for children with rare diseases, you tend to see patients from all over the country. Getting access to medical care is still a problem. The institution helps, and the Ronald McDonald House helps. The institution helps by providing transportation, and the Ronald McDonald House helps by providing domicile for patients. It's a remarkable thing when our social workers sort of grab onto a family and guide them through the process at the minimum amount of cost. And it's an institutional imperative, I would say.
The Cohen Medical Center provides a lot of support for us. We have other departments who help us with like statistical analysis, and we have support making our database. They also allow us to have patients coming. A lot of times they don't get paid for these patients to come. They come from other places throughout the country, and their insurance may not cover being seen by us, but they travel far, and the hospital kind of allows that for us. So we're thankful for that.